Broadcasting from the business capital of the world, this is the Podcast Business News Network.
I don't have to tell you how important sleep is. You don't get a good night's sleep a couple of times in a row in a week, or even not in a row. If it just happens that way, you can't really function. You can't think clear. You don't have that pep in your step, that joy of attacking your day. Sleep is so essential. Many of us have sleep issues, don't even know it. We've talked about it before with this gentleman who has now made it his life's work to help people with that, with a sleep medicine practice. And he's got the number one alternative to CPAP therapy to help you sleep better. He's back with us from Kansas City, Missouri. Dr. Randal Silver is on the program. Welcome back. How you doing?
Good morning. Thanks for having me back. Doing great.
We've learned so much so far in the last few podcasts. I want to dig deeper into the appliance that you custom make for somebody when it's identified that they've got sleep issues. Is it always a sleep study to get them to your office? Does it always have to start that way?
You're mostly on point there. So patients don't have to come in with a sleep study already. But for those that have not had a sleep study, we will facilitate that for them. I think what your question was getting to, before we do any treatment, we've got to have a diagnosis from a sleep physician. So
Yes,
that's a cornerstone of our treatment.
it is. Okay, gotcha.
Yeah. Yeah.
And at that point, is it reasonable to think that they may have tried CPAP or considered it? And or would it be a situation where somebody had the sleep study, it was identified what their issues are? CPAP could be a remedy, but they're looking at saying, I don't want to sleep with a mask on doing that. Would they
Yeah.
come to
So
you?
yeah. So I hear all of that. So a lot of patients will come to my office and they've tried CPAP.
Okay.
I've seen a bunch of different statistics on it, and it's about 1 out of 2. Some will say, oh, maybe 1 out of 3 can't use it, but at least in my experience in this area, about it's a 50-50 shot. So, and that's typically where most MDs will start patients for treatment. They're most familiar with it. That's what they're told to do in med school. It's kind of like, all right, you got someone that's really tired, give them the sleep study. If it's positive, they go on CPAP. And that's kind of, where it stops. I mean, so many patients, when I talk to them, they're like, what? There's other options? So
Ah,
there tends not to be a deep dive into it. It's just kind of like, okay, you've got sleep apnea. Here's your CPAP. Good luck. I hope you can use it. So we do get quite a lot of patients that come in that, oh, I have my CPAP's under the bed or in the closet or haven't put it on for, a year and change or whatever it might be. And then we also do get some patients that, that they just tell their doc right out. They're like, hey, I know I can't use that. I won't be able to sleep with that mask on my face. And for those providers that are aware of these other alternatives, and they're like, oh, hey, go see Dr. Silver.
are there times where somebody can come to you, even if they didn't reveal the result of the sleep study? Or I know that you do dentistry.
Right.
If they came to you and said, Dr. Silver, I'm not sleeping that well. It's I got to start looking into this. Are there times when you can examine them and tell right out of the gate, yeah, based on what I'm looking at here, your bite or whatever that may be, you could say it's reasonable to think, yeah, that we got something going on there that's going to prevent you from sleeping well.
Yeah, that's actually a really good point. And as far as being a dentist, when patients are in the chair, we've kind of got that great view of their airway during that whole appointment.
Sure.
And with the prevalence of so many people going undiagnosed, the American Dental Association actually came out about 10 years ago, basically begging's not the right word, but like strongly encouraging the dental community to be like, hey, you guys need to be including an airway screening along with your
Hmm.
dental exam to
Wow.
help screen for this, because there's a lot of clues uh, in a person's mouth if they're suffering from sleep apnea.
Gotcha.
And there's just things from, grinding patterns on the teeth, the size of the tongue, the way the tongue moves when a patient just opens their mouth. Does it protrude back towards the airway just when they open? We'll look for a condition called scalloping on the tongue. People with sleep apnea, the a lot of times the tongue size is too big for the space of the jaws. And that has to do a lot with the way our jaws are developing with our modern diets. One of, like to say he's a mentor, but I've just read some of his material. He's a big dental sleep medicine practitioner. And he wrote a book, and he coined the phrase 6 foot tiger in a 3 foot cage, which I absolutely
Hmm.
uh, love that phrasing. And it's one of the things that we can really look for when a patient's in the dental chair, which just goes back to the point, is that tongue size too big for the person's jaw space? And when that happens, it's very easy for the tongue to fall back into that airway, And so, we're looking at the uvula, or the, the tissue that hangs at the back of the throat. We're looking at tonsils, and you know, when you couple that also with what the patient fills out in their medical history, um, we have a pretty good idea of people that are at risk for having us.
You say uvula or uvula. I'm trying to.
Uvula, yeah,
Is that all right? For in layman's terms, as a kid, we used to see it. Is that the punching bag at the back of your throat?
yeah, that's correct. Yeah,
Okay.
yeah.
What's the function of that?
Uh, it's really just to help prevent you from like choking. It kind of acts as a little barrier back there and aids in swallowing.
Is it no, just a quick anatomy lesson here. Is
Sure.
it a something that detects an object in the back of your throat, piece of food or whatever it is, because it's sensitive and that sends a signal, or is it actually, like a hand, pushing back?
A little bit of both. I think that's a decent description.
Okay.
Yeah. Yeah.
You know, interesting what you said before in that the sleep apnea community was asking dentists to examine those things. I remember it was probably going back about 15 years, a little bit less, maybe like 12 or so, where it was a call for dentists to examine the tongue for tongue cancer and things like that.
Oh, sure. Yeah.
Yeah.
Yeah. So, that should be a part of every dental exam, is an oral cancer screening, so we're looking around, making sure that we don't see any signs of any cancer or precancerous tissue.
Gotcha. So when it comes to you fashioning an appliance for sleep apnea, it's custom
Yeah.
designed after the sleep study, and it's all been set up. Patient gets it. How often is there a challenge with a patient where it doesn't work for whatever the reason may be? Either they're uncomfortable with it, or it just doesn't work for them, or whatever.
Sure. No, that's a great question. And that's always something I discuss with my patients before we get started. The devices, they're not 100%. So I can never look a patient in the eyes and be like, this is definitely going to work for you. I'm not sure that there's a whole lot in medicine that is considered 100%. We're all different, and so these devices have been around since the early '80s or maybe even before. And there's been a lot of research and a lot of studies on how well these appliances work. And what they found is if you have mild to moderate sleep apnea, that they're about 88% effective. I've seen some studies show it as high as 90. So they work really well in the mild and moderate range. Um, and for those patients that have severe sleep apnea, we do tend to see some diminishing results, and that's what I've also seen in my practice as well. I've got plenty of patients that I've successfully treat and manage their severe sleep apnea. I've got some where, we've made a significant improvement, but we didn't quite get all the way there. And I've had some that were non-responders. And then we got to talk about,
Wow.
hey, do we want to go back on CPAP or do we want to try a surgical?
Can you walk us through the process? Somebody comes in, has a sleep study done. It's been identified. Yes, we have a challenge here. What happens there, step by step?
So in my practice, patient comes in if they have already had their sleep study done and we're looking at it. Uh, First, it's about a 45-minute to an hour consultation where we really kind of dive deep into what's really going on physiologically with the anatomy, what's happening as their brain is waking them up and getting them so that their airway pops back open. So we talk a lot about the risk factors associated with untreated sleep apnea. I feel like the patient education part is important. I want patients to be involved in their treatment, to know what their risks are, to know how important treatment is. And so we go over the fact that, it puts you at a higher risk for stroke and hypertension and diabetes and all the other risk factors associated with it. Um,
Mm.
so we do a lot of that. We talk about in detail specifically about their specific sleep study, we review the numbers and talk about how often they stop breathing at night and what happens to their oxygen levels and how many times they wake up. So after we review all of that, then I go over all the different treatment options out there for them. So we discuss again CPAP and how it works. We talk about the dental devices and how they work. And then we go over several different surgical options that could be available to them as well. Typically, by the time a patient gets to my practice, they're already wanting to do the oral appliance. So typically, after we go over those treatment choices, then we sort of just kind of move into the next phase. I do what's called I call it a dental exam light or a mini dental exam. So it's not like going for a regular checkup and cleaning. I'm not looking for every single dental thing in that visit. But we just got to make sure that the patient is a candidate, that their teeth are strong enough for me to put a device on them, their gums are healthy enough, and that their jaw moves in a reasonable way. They pass those three things, and then typically we move on to all the documentation we need for insurance and with their medical provider. And so it's a group effort to get them into compliance.
Wow, I never even considered that the gums, the teeth have to be in good enough shape to support the appliance. Never even considered that. Wow.
Yeah, so there's been a couple of occasions where patients come in and we've been discussing, getting them into an appliance, and then we get back into the dental chair and it's like, wow, we've got a lot going on here. I'm like,
Mm.
some cases I'm like, hey, you've got to go back to your dentist and get caught up on your oral health before we can start. I've had a patient or two where there's been so many broken, rotten teeth. I'm just like, doesn't matter what you do, we're not, maybe if you got some dentures that were stable. And then I've had some patients that have come in that do wear dentures. Some that the dentures, when they fit really well, we can put an appliance over that. It is kind of a mouthful to already have dentures in your mouth and then the appliance in there. But if a patient can't wear CPAP, they're like, hey, I want to try, you know. And I've also had other patients that have come in with the dentures and they're not fitting great. They're loose. And I'm like, hey, we've either got to do implants or got to get a new set here or something, because we got to have the stability first before I can place anything.
Wow. If it does come down to surgery, and I'm
Yes.
guessing that's probably a very small percentage, but it's it's an option if needed. Uh, how invasive is it? What needs to typically be done? Every case is different, but on average.
Sure. So there's different surgical options. So it really depends on what the patient is wanting. I'd say the Inspire implant is probably the most popular option. They do quite a bit of advertising. There's probably a lot of people who have seen their commercials. They do a big thing about no mask, no hose, just sleep. Um, I don't love that commercial because they forget to mention that you have to have surgery. So they kind of sell it on the commercial like, oh, this is just easy peasy. But
Well, it's
it's
almost
a
like you see, for diabetes drugs and such, where people are dancing around, having a great time. It's every
right,
single one is the same, lots of bright colors, and it's like,
right,
okay, then we get to the side effects. But anyway,
right. Yeah, no, for sure. So, but it's an implantable device. It's called a hypoglossal nerve stimulator. And
hmm,
the best analogy I have is it's kind of analogous to like what a pacemaker is to the heart. This device would be to the airway. So you get the medical device implanted in the upper chest area. They run a wire that connects up to a nerve that hugs the jawline here, the hypoglossal nerve.
wow,
And when the patient activates the device at night, it will actually sense when the tongue and tissues are falling back, and it basically tells the nerve to fire, which causes the tongue and tissues to move forward and out of the airway. Um, so it's nice that it's kind of patient that's kind of automatic as long as they just turn it on before they go to bed. It 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 works about 2 out of 3 times. They've found that about 1/3 of people are non-responders.
wow. After the surgery.
Yeah,
Interesting. And you're right on target in my mind about the analogy to a pacemaker, because
yeah,
it's implanted under the skin. There are wires that
yeah,
fire in some regards.
yeah,
Wow.
yeah.
I didn't even know that existed. And it seems like there's so many variables there, different, complete layman here. But and by the way, my girlfriend just had a pacemaker replaced. So it's
Oh,
on my radar.
sure.
Start
Yeah,
talking about that. And she's
yeah.
had one since in her 20s. Um, but that seems to me, if it's a pacemaker, it's a direct firing to the heart, where this is going to a nerve. It just seems like there's a lot of latitude and variable situations here, whether it's going to work or not. Does that make sense?
Yeah, I mean, I think it's a little bit more straightforward than that. The way those wires connect, it almost like wraps around part of that nerve bundle. And I don't want to claim to be an expert in this procedure
Sure.
at all. It's not something that I would ever do. But um, and it's the way that that wraps around that nerve cell that it's able to both detect when that tissues are falling back and to send basically the signal just right to that nerve to make them.
Wow. In one regard, cool. In another regard, hmm.
Yeah, I
That's just
mean,
me.
yeah, no, I mean, I've actually had some patients come see me after they've had it done. They didn't like it. They didn't like the way it made them feel. They didn't like how it felt with their tongue sort of shooting forward. So like, yeah, I don't. They're like, I don't turn it on, and I'd rather now go with the dental device. So
Wow.
they've got the implanted device, and they're not using it, but they're using my dental device instead. Um,
Huh.
but and there's, I mean, I just want to be clear. There's plenty of people out there that are really happy and really satisfied with the Inspire. And
Sure.
there's also other surgeries as well. There's a common one called the uveal palatal pharyngeoplasty, where you go see a surgeon and they're basically cutting out some or all of the uvula and taking out some of your soft palate, sometimes thinning out the tongue, really just trying to make that hole in the back of the throat, that much bigger. And then a lot of times we'll take a look at like an ENT referral to take a look at the nasal passages and the sinus cavities and see if there's any obstructions or a deviated septum, or if things aren't working and flowing in the very upper respiratory area. That can also impact your sleep and your sleep.
Do a large majority of people breathe through their mouth when they sleep, not necessarily causing sleep apnea, just that's how they breathe? Or is that a recipe for sleep apnea?
So our bodies are designed for nasal breathing. The way your nose is designed and the turbinates in there and all the different little microstructures in there that help like filter and warm and causes the body to produce more nitric oxide. So that really should always be our main way of breathing, and the mouth is really the backup. So for people that are mouth breathers, it can lead to sleep apnea. It also can exacerbate sleep apnea as well. Constant mouth breathing can cause the tongue to enlarge. And as we already kind of talked about, the larger your tongue is compared to your jaw space,
Wow.
the more likely you are to have sleep apnea. Yeah. So, for patients out there that do wake up and they wake up with a real dry mouth and they've been breathing through their mouth, a little bit of sleep tape can help encourage patients to keep those lips together and do some nasal.
Sleep tape?
Sleep tape.
Wow. So this is something that I'm guessing you put over your mouth to encourage your mouth to stay closed while you're sleeping?
Yeah. So, and it can be something as simple as like a little bit of like medical grade tape, and you just kind of put a little strip over your lips there. I actually got a big box of free samples from a company called Hostage Tape. It's like a little black, it's like a little black circle, and it covers your whole mouth. It actually works really well, and it's surprisingly more comfortable than what people might think. I did it for about 2 weeks just to see what it was like, and it's no big deal. So, and it can make a big difference.
Obviously, I have to ask the question. You have
Yes.
that tape on.
Yes.
Let's say you have reflux. Your nose gets a little stuffy. Now you can't really breathe through your nose. You can bust through the tape if you need to while sleeping.
Oh, right. You're not like, you're not like bolting things down or anything, right? And all these medical grade tapes are fairly easy to remove. Now, obviously, if you're already like, if you've got the cold or a flu or your allergies are really severe, right? So if going to bed, you're like, man, I'm all stuffed up and I can't breathe at all through my nose. Maybe not a good night to do some
Right.
taping.
But it won't have adverse effects is where I'm going. You could if you need to breathe through your mouth while you're asleep, you're going to open your mouth no matter what. And
right. Yeah, you're not locked in.
Gotcha. Interesting. I learned a lot today. Gotta tell you.
Yeah.
And we went in different directions here, but it just all comes back to sleep apnea solutions. One great one, the number one alternative to CPAP, which you provide. Randal, how do we connect with you? How do we find you? I know that you're also a resource for anybody on the planet. Obviously, if somebody wants an evaluation, examination, and even consider the actual appliance, that's in Kansas City or nearby where you are.
Correct.
Okay.
Probably the best way is just to you can find us online, www.sleepmattersllc.com, and you'll be able to find us.
Yeah, fantastic. Thank you so much for all the details. So important, everything we're talking about here. And a lot of times I think we minimize sleep.
Yeah.
And we don't realize when you add up how much time you should be sleeping, it's a big chunk of your life. And what's really going on there behind the scenes. Truly appreciate all the details and all the info. And thank you so much for being here today. Really, really insightful and informative. Really was.
Yeah, great to be here. Thanks for having me.
Thank you. Coming right back.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
Mortgage-free, fully adaptive, handicap-accessible house. And there's no catch.
It'll be our very first home that we've ever owned.
This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.